I'm going to explain to you why home birth with a well-trained attendant is 1,000 times safer than hospital birth for low-risk women. More babies are said to die at home birth than hospital birth because of rare serious emergencies that are better dealt with in the hospital. This myth is maintained by everyone ignoring the obvious question: what do low-risk babies die of at home birth? The answer is an average weight baby coming out head first at full term whose mother doesn't smoke or have intentions to murder her simply does not die at attended home birth unless they have defects incompatible with life, like missing lungs or part of the brain that controls breathing, with the exception of about 1 in 10,000 babies where the attendant breaking the water causes a cord prolapse, which results in death of the baby. Overall birth is a sure thing in cases where the baby is term and head down. Because low-risk birth is such a sure thing, hospitals work very hard to sell their product. One of the favorite myths promoted in hospitals is that they somehow saved the baby's life because the cord was around the neck or there was a knot in the cord. 35% of births have a cord around the neck. The cord is not a noose. The cord is floating in a bath of very hot water happily. Babies with cords even 4 times around the neck have better outcomes than those without a cord around the neck. There are 4 serious events that can complicate low-risk birth. They are all caused by routinely breaking the water and/or inducing labor. They can be eliminated by eliminating those interventions. The studies concluding that attended low-risk home birth has 3 times or 10 times the rate of newborn deaths compared to hospital births include irrelevant data like unattended or premature births or stillbirths before labor began and make obvious errors in simple math. What makes it completely clear that they are lying is they never look for a single reason why low-risk babies die at home birth. Resuscitation works better at attended home birth because the skilled person is right there with the baby and does resuscitation leaving the cord intact, providing 2 extra minutes of residual oxygen, heat, and blood volume from the cord. In hospital, the dying baby waits cut off from the placenta until doctors arrive in the room. Shoulder dystocia is easier to deal with at home than in the hospital. Wherever you are, you have only 5 critical minutes to deliver the baby without damage. At home, you get right into action. In hospital, you lose 2 minutes untangling the blood pressure cuff, the IV, the epidural line, 2 monitor belts, and lowering the bed, sometimes on an anesthetized woman. In any case, shoulder dystocia does not result in newborn death. 10% of babies suffer anoxia but are resuscitated, and those that die weeks or months later. Meconium aspiration and water on the lungs are prevented at home birth. At home, most women deliver in all fours. While only the head is out, the meconium or water drain from the lungs, and when the body comes out, the nose and lungs are clear. Postpartum hemorrhage is another complication prevented by attended home birth. I have prevented all severe postpartum hemorrhage with a simple protocol I call Judy's 3-4-5. At 4 minutes postpartum, you get the woman into the position demonstrated in this picture. Her feet have to be flat on the floor, which is difficult for most women, but not impossible. Going to the hospital results in life-threatening complications because it interferes with the normal hormone release, puts the woman under a time limit for delivering, involves electronic fetal monitors, laying in bed, the presence of strangers, foreign smells and voices, inductions, epidurals, augmentations, episiotomy, and high cesarean rates, all dramatically increasing the risk of bad outcomes for either mother or fetus or both. Inductions have not been shown to decrease the risk of stillbirth except in biased, low-quality studies. On the contrary, zealous inductions occasionally kill or cause brain damage from the lack of oxygen to the fetal brain. Maternal mortality rates are increasing because of the 1 in 3,000 women who die from cesarean surgery. The only complication of attended home birth is the 1 in 5,000 or 0.02% risk of cord prolapse, which can be avoided by severely restricting vaginal exams. In hospital, there are 12 hospital-caused complications which put 20% of low-risk hospital births at risk of a life-threatening complication. When you choose hospital birth, you outsource your birth to a practitioner who has different goals than you do. If their goals were to optimize your birth outcomes, they would advise you to have a home birth with a well-trained birth attendant. If they wanted optimal outcomes, they would become home birth attendants and avoid the many common life-threatening, well-documented dangers of hospital birth. Taking responsibility is hard work, but it results in the best birth outcomes. It means good prenatal screening and nutrition, exercise, a positive attitude, and choosing a supportive, well-trained home birth attendant.